Like COVID-19, tuberculosis is an infectious disease that primarily attacks the lungs. While both diseases have similar symptoms such as cough, fever, and difficulty breathing, tuberculosis has a longer incubation period with a slower onset of disease. According to the World Health Organization, people ill with both tuberculosis and COVID-19 may have poorer treatment outcomes since they are considered high-risk patients who may experience severe forms of COVID-19. However, the National Tuberculosis Program is reporting the recovery of at least 2 patients who were treated for both tuberculosis and COVID-19. Dr. Jamal Duncan, government medical officer at the program, during an exclusive interview with Nightly News on Monday, informed that the patients who were diagnosed with active tuberculosis are still undergoing treatment.
Things that they would have recovered from the COVID-19 because the period of infection and the symptoms and so on is shorter, because TB treatment takes months. So they would have recovered, but they're still on TB treatment at the moment.
He explained that for active tuberculosis, patients are required to take antibiotics for at least 6 to 9 months. Dr. Duncan noted that depending on the type of tuberculosis a patient is diagnosed with, once they contract COVID-19, they are given medication for both diseases simultaneously. Last month, the antiviral drug remdesivir was approved by the United States Food and Drug Administration as the only treatment for the coronavirus. The ongoing presence of the outbreak has changed the way tuberculosis patients are cared for at the Georgetown Public Hospital's chest clinic. In an effort to reduce physical interaction at the clinic, Dr. Duncan explained that patients are stocked with excess medication to last them for a period of time.
But with COVID-19 and the risk of exposure, what we've done, we've given them more treatment, mostly a week treatment and so that they can at least reduce the amount of time that they're coming to the clinic. Another thing that we've done, we've also increased the dates, the visit dates, so they're not coming as often as they would have previously.
Additionally, functional screening points have been erected at the chest clinic. Although tuberculosis and COVID-19 can be tested using the same type of specimen, each disease requires a different screening and triage regimen. Dr. Duncan is strongly advising patients living with tuberculosis to observe all the protocols necessary to reduce their risk of contracting COVID-19.
Follow all measures that have been in place by the Ministry of Health, which will include hand washing, right? Distancing, the 3 meters, the 3 feet to 6 feet away from individuals. Avoid crowded areas. The use of the face mask, the proper use of the face mask, right? Eat healthy and make sure if once you're on your TB treatment, you use it properly and you use it on time. Don't miss any dates.
Temika Rodney reporting for the HGB Nightly News.